The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Estamos presentes con ellos.
Good afternoon, everyone. My name is Dr. Charlene Ortiz, and today we are going to talk about qualitative research designs. Not all research can be done in the fashion of statistics. Sometimes we're not aware of a phenomenon or a group of people in a very specific detail. Therefore, qualitative research fills that need. It fills the gap for perhaps a form or a type of phenomena that we're not used to. Therefore, we need to understand the qualities of the phenomena or the group of people that we are trying to research. So let's get started. We have talked about very briefly in other lectures of the characteristics of qualitative research designs, but there are multiple aspects that one wishes to cover in order to provide qualitative research and be able to conduct qualitative research in a trustworthy manner. One of the things that I would like to highlight is credibility of the research that you are trying to provide. When we are thinking about the parallel, right, or the parallel that we would have in research specifically, we are thinking about credibility. You're thinking about internal validity. So internal validity, remember that it's the capability of that study to represent and study what it's intended to measure without any possible factors that can impact that meaning, right? That form of interpretation. So let's think about what does trustfulness mean. Here, what we're trying to see is whether or not what you observed, right, in your results does it in fact reflect that reality, right? Remember that whenever you're doing qualitative research, we generally don't have a big understanding of the phenomena that we're coming across, right? We want to make sure that it does in fact reflect the experience of that participant, the reality of that participant. We want to make sure that we do so in a way that even the participants themselves would agree with your report, right? How many times have you read something about you, i.e., for instance, the feedback that you guys provided in writing for me in class, that may read this and say, I don't think this is representative of me, right? I sincerely don't think so. That can happen if your research study is not filled with trustfulness, because you want to make sure that whatever observations you made do actually reflect those ideas, those thoughts, those beliefs, the behaviors that you are trying to observe. Now, if we move to another characteristic, we are going to mention transferability. And this sounds an awful lot. Of the concept of external validity. If you remember the concept of external validity, you'll recall that external validity is the validity that allows me to generalize the results to another population, right? So if I am studying, say, alcohol consumption in college students, right? Can this data that I found out, that I gathered, collected, and analyzed, interpreted, and analyzed and later presented, is this information about college students relevant and applicable to, say, the next campus? What about a community college? What about an Ivy League? What about a really small university? So that's what we refer to external validity. It's my ability to be able to generalize that information to another larger population. But in the description, when we are talking about qualitative research, we are referring to applicability, right? How much, what is the extent of these results? How much can I apply these results beyond the context of the research? How much can I actually utilize this information towards another group? So for instance, if I am trying to study a very specific group, right? So that sounds very qualitative. I want to study persons who identify as transgender currently in transition at a big university, right? Their levels of stress, right? Notice that the information that I'm gathering, I'm trying to determine whether or not this information can be applied outside of that college campus. Right? I'm trying to see if I can apply it, say, for example, with other types of individuals. So for example, say, I'm trying to apply it to Black or African American transgender people who are in transition in universities. We are considering the term of dependability. Consider the parallel on the quantitative side of things. I want you to think about reliability. And for those of you who recall, right, who can tell me what reliability means in a research or statistical sense? Correct, how consistent a study is. For example, if I have an assessment, right, and in lab, we actually did something like that, right? We actually did something like that where you guys were trying to identify instruments, right? And some of you identified, say, for example, instruments and assessment tools for autism and all sorts of wide variety of assessments. But notice that, say, for example, the assessment that you picked, say it was for anxiety. We need to find out the reliability, which is the consistency, as you noted, of every time I administer this assessment, I am going to get basically the same results. It will not vary over time. That's what we're looking for in regards to reliability. We get the same similar result every time this assessment is used. So now that we understand that concept, how does that translate into the qualitative side of things? Well, consistency, because what we're trying to do is that these results that you have observed stay similar, right? If they stay basically the same, if I were to conduct this research in the same or a similar context, right? If I'm trying to find out this information. So notice that if we're doing a qualitative study about transgender persons in a college setting, you would like to see that there is a consistency, right? So for example, if you identify some sort of stress, right? Their experiences here, and they start reporting, say, I have discrimination from faculty, or I have discrimination from staff. If it is reliable, we would expect that observation, we can find it later on, say, for instance, on another college campus, or even here. Maybe you did that in the fall semester, and then when you do it in the spring semester, you start getting the same patterns, right? So that's what we refer to, that consistency. So any questions from you guys or our folks online? Good deal. So if we refer back to our slides, the last point that I would like to mention is that of confirmability. And what does that mean in another sense? Well, we're trying to be objective, right? We're trying to be neutral in regards to your observations. What we're trying to refer to neutrality is that your observations, you're trying to find out the extent in which those experiences that you observed are exactly what you're reporting on and not the researcher's perspective. You want to impose some neutrality when it comes to your observation. And why is that? I would argue that that's probably one of the most important, and if not the most important factor of qualitative research. If I am already coming in with a preconceived idea, a preconceived result in my head, a bias, thinking that, yes, this is a result that I'm going to find, how much do you think that's going to affect my observation of these individuals in their natural environments, right? In their experience, and then reporting their needs, beliefs, and desires, right? Viewpoints. If I'm already coming in with that type of mentality, how accurate is your study going to be at all in general? So I like to argue that this is probably the most important aspect of qualitative research. So any questions about that? Good deal, good deal. So let's refer back to our slides. Now, I keep talking about qualitative research. Well, we're going to identify and we're going to describe some of the most common qualitative research that we like to conduct. Now, the first one we're going to talk about is a phenomenological study. A phenomenological study, what it refers to is that I'm trying to analyze a phenomenon. I'm trying to analyze a phenomenon. Generally, it involves the first person point of view. Generally, what we refer to a conscious experience. What is conscious experience? It's basically any experience whatsoever, any experience that the person has lived through or performed that we are able to bring back from memory, right? We're trying to bring that back to memory. So if I were to ask you, do unconscious experiences, right? So if I'm trying to find out, as you know, some of the more Freudian stances, if I'm trying to do a phenomenological study, would that be something of interest? Not necessarily, because we are trying to focus on that conscious experience, something that I can bring to the surface and narrate and explain to you. Now, another thing, if we refer back to our presentation, it has to have an intention. I want to make sure that the meaning of the participants' conscious experiences is indeed being observed. It is intentional. I'm trying to find out the meaning of this experience, right? Remember that I need to also consider their intentions, right, in reporting that specific information. Any questions about that so far? Good deal. Let's think a little bit more about objects of awareness. When I am talking about objects of awareness, we're talking about what is it that I can narrate, right? What type of experience can I actually express to you? So for example, if you've had a unique experience, let's say you've served in war and your job was to conduct intelligence, right? Find out where we just got attacked from and find out coordinates as to where the attack occurred so that we can go in and neutralize or detain the target. That is a very unique experience, right? So what I am trying to do is make sure that I identify the awareness of the situation and that it is indeed a conscious experience, right? We're not there to interpret why is it that this person reacted the way that they reacted? Is there an underlying factor? We're simply trying to think about the more conscious side of things, the things that I can actually narrate to you as if it is a story, as if you just watched a series on Netflix, like Squid Games. Am I right? Who watched the show? Pretty good, right? So you basically want to narrate, you want the participant to narrate their experience to you, just like they would a series on Netflix. Now, one of the last points that I want to talk about a phenomenological study is the role of the researcher, you, as that person who is going to be gathering this data. How is it that we're going to gather this conscious experience? How are we going to get this narration of that conscious experience? Well, we're going to interview them. We're going to interview this participant. And then we are going to construct a narrative to summarize the experiences that were described in that interview. Notice that that can be a problem too, huh? Because if I am trying to summarize a narrative, imagine that somebody is telling you about the series that they just watched. They themselves are providing you a summary of what they observed, right? The way they view the last episode of Squid Games. That's already a summary. And your job as a researcher is to summarize the summary of the narrative. Notice that there is a lot of issues that could come about that, right? Because there's some information that can be missed. There's some information that can be misinterpreted. So it's really important that you try to stick as much as possible to the narration of the individual. So any questions about that from my folks here or my folks online? Good deal. Now, when I say that we want to stay with the participants, right? We want to have that context, right? We need to make sure that we're also observing not only what they're trying to describe, but also in the context through which it occurred. So if, for example, I start interviewing this person, right? And they're telling me about their experience and they say, I feel harassed or I feel immensely uncomfortable if people try to approach me or people try to approach me from behind and I start getting really upset, but I know if they're grabbing me or touching me, it's for my safety. Notice that without any context, you're like, what is their experience, right? But maybe if I give you a little bit more context, say, for example, this person is being searched by the Transportation Security Agency or TSA at an airport, maybe that narration now made a little bit more sense. So let's talk about the different types of contexts that we can find that allow us to interpret, that allow us to observe that narration. So one of the first ones that I want to talk about, if we go back to our slides, if you go to the very top of your slide, you'll notice that we have a historical context. So what do I mean by a historical context? What we're thinking about is any relevancy that we can find, say, for example, in a political setting, societal, geographic, anything that involves a historical perception in regards to that person's experience and also their personal histories, right? And this here is an excellent example. A person that was pre-9/11 versus post-9/11, someone that went through that experience. So some of us got to fly and get on a train and do so many things without any aspects of very enhanced security, right? So there was a time where people could just walk up with you to the gate, like your family can just walk there with you and say goodbye and give you a hug, give you a kiss, start crying, I'll see you later, enjoy your vacation, right? And of course, that doesn't happen anymore. Why is that? Because they have enhanced security as a means to protect the amount of people, have control the amount of people that can or cannot board, if they're indeed supposed to be there or not, because they have a boarding pass. Notice that historical event of 9/11 will change the context and the perception that an individual can have, for instance, about security, right? So any questions about historical context as an aspect that can impact that self-description, that self-narrative? All right, good deal. Let's talk about the context of a political or government context. Notice that this can have a significant impact on how an individual narrates their experience. So a really good example also, notice that legal issues that can impact an individual is a great example. Think about the legality of same-sex marriage, right? People like me, I consider that the majority of individuals from my previous generation, like my parents or myself, I sincerely thought that same-sex marriage was not going to be a thing in my lifetime. I sincerely believe that. Like, that's not going to happen anytime I'm alive. I thought it was probably going to take another, maybe my children's generation or my grandkids' generation. But notice that that perception, right? The perception that your parents had, my parents had, our grandparents had. And if we were to interview them, if we were to do a qualitative research, say, for example, with a person who identifies as gay or lesbian, and their narrative of their experiences of relationship and marriage, that is going to be very different from that person that is going to be here today. And you're thinking, why does this matter, right? Because I like giving you guys like real life examples. Imagine that you have a client, right? And you've been seeing this client for a long time, and they're here because of acceptance or rejection of their gender identity or sexual orientation, gender expression, right? Remember, they're all not the same. If you don't know the difference, please come talk to me, because you guys are in an advanced class and I want to help you as much as I can. So think about the presenting issues of that client sitting right across from you. Those issues, those presenting issues are going to change, for example, should the legal aspect of things change, right? Because now the problems that they used to have can become exacerbated or better now that the, say for instance, the legality of same-sex marriage occurred, right? Not only that, maybe you start seeing mom and dad, right? Now you start seeing mom and dad because now they are adjusting, right? They're adjusting to the change that something in a political context and a legal context has changed. So yes, you will see that. You will see that kind of frequently in your practice. The next context that I want to talk about, and this one, I feel like with our interns, we talk about this one a whole lot. And that is, and of course, they're not my interns, but we do have interns that work where I work. And that is the societal, cultural, and religious context, right? Notice that based on our society, our culture, and our religion, we can have certain aspects that will be influenced, right? So for example, health, the perspective of health, cultural norms. For example, what is a common religious practice? Notice that this context is going to guide your behavior. And I believe, if not for this class, it might have been for another of my classes, but I'll bring that example up, real life example. If I were to tell you that every night when I'm all alone in my house, I can hear my grandmother who passed away in 2006, right? I can hear her, I can feel her in the room with me. What would you think in terms of diagnosis, right? You're like, I ain't no doctor, right? There's something's going on, right? But what if I give you a religious context and I say, I pray to my grandmother every night so she can keep me safe and I feel safer. I pray to her so she can watch over me from heaven, right? That now doesn't sound like a symptom, huh? That sounds like a religious context. And it's great because we actually go through that a lot in regards of our interns. So it's really good to have those discussions. So notice that the context, you went from, this sounds like a possible symptom to like, oh, she's praying, right? It's a religious context, right? Now, when I narrate that experience, right, if I were your participant and telling you, okay, this is how I feel through prayer, right? So if I were to tell you that, you're thinking, oh, this is her experience through the religious context. Geographic context is also immensely significant because where you are will inherently affect your experiences, your beliefs, how you perceive things. So for example, if you grew up like I did, I grew up in downtown city environment, right? And it's crazy because the way I grew up, it had a great impact because quite literally, this was the wall for my bedroom and my headboard's right here. And this is the sidewalk. That's how I grew up. That's how city I grew up, right? Literally my headboard's right here. And this is the wall, one of the walls of my house. And this is the sidewalk, right? The big old window right here. Notice that my experience of growing up in a city downtown environment might be a little different for those of you who grew up, say, for example, in little town so-and-so, say, Mississippi, with a population of 600 people, right? So notice that my experiences you and I are not going to narrate the same experience, for example, of growing up the same. If nothing else, because of your location, because of your geography. This is something that many people forget, and this is something that you will see in practice a whole lot. Your temporal context. Clients, patients sincerely believe and sincerely forget about the temporal context. You're going to have a wide variety of clients and or patients that are going to say, he's never going to change. I'm always going to be the same. I've always had depression. It's not going to get any better. My wife has always assaulted me. She's always beat me up, and she's going to remain the same. Notice that that is because we're lacking a context in which we, and those of you who are going to go into practice, we're in the business of changing behavior. The context of changing individuals over time. You can do, for example, if we move back to the research side of things, notice that, say, at the beginning of the interview, you are super nervous, right? Like, oh my goodness, I have never done an interview. I am so scared, I'm going to mess up. Or maybe this is your first time as a research assistant and you're freaking out. It's like, oh my goodness, this is going to be so tense. But then as your demeanor starts to change during the interview, notice that as that is changing during the course of that interview, maybe the context of the questions is going to change. Think about how would you respond? How would you respond to class if I was shaking, if I was stumbling on my words, if I couldn't come up with an example on the spot, or if I couldn't come up with examples before, like on YouTube or things of that nature? How would you respond to class? Really differently, huh? But if I show confidence, if I show approachability, if I prepare the slides, notice that your response is going to be different. Notice that that response over time will change. And remember that if you are in the field of psychology, counseling, social work, things of that nature, you're in the business of changing behavior over time, right? That's literally why you're here. You're here to help individuals have more well-being through change. Gender will have an impact on how that information is perceived. Even, for example, if you're considering the gender of the participant and or the gender of the interviewer, right? Imagine the last time you had to go to a physician, right? The last time you had to go to a medical doctor. How comfortable were you with that person's sex, right? So if you're male, were you comfortable with another male as a physician, or you were comfortable, you'd rather off be there with a female, or vice versa? Most people, even for mental health, by the way, prefer someone of their own sex, generally. People prefer someone from their own sex, whether it be a mental health practitioner or a medical provider. So generally, there's more rapport, more trust, because they are from the same sex. And it applies for both the medical and the mental health field. And the last point that I want to talk about is familiarity. When we're thinking about this particular context, notice that if sometimes we can only describe an experience when we actually take the time to reflect upon them. Sometimes it's a little difficult to come up with a narration or an explanation of something that has occurred, that phenomenon that has occurred, right? Because at the time, we lacked that familiarity, right? We lacked the familiarity with that experience. Any questions about that here or my folks online? Good deal. Good deal. So if we consider other forms of research, for qualitative research, let's take a look at an ethnography. For those of you who are interested in sociology, I think I have someone here whose minor and or double major is sociology, or am I confusing you with someone else? There you go, see? I pay attention, see that? Pay attention. So what can you tell me about this type of study? Have you heard this before? What can you tell me?
based on like the cultural group, is that correct?
Yes, ma'am.
Or like regional, something like that?
Yes, ma'am. So Dr. What's your last name?
Harper.
Parker?
Harper.
Harper. So what Dr. Harper is mentioning is that an ethnography is based on a group of people, is based on a culture. That is absolutely correct. What I am trying to do is analyze, I'm trying to observe, I'm trying to analyze the behavior and identity of a generally very specific group or a specific culture. So for example, when we're thinking about a group, when we're thinking about a culture, military culture, police culture, undergrad culture, graduate culture. So I don't want you to think it just involves like, say, for example, the macro side of things. So American culture, Southern culture, Northern culture. Think about the other cultures as well. We tend to forget that a lot. And unfortunately, that's probably what you're going to see more in practice, right? You're trying to be a little bit more narrow and focus on the needs of that client. And sometimes that involves saying their whole family has been police officers for generations. And of course, the behavior and identity of this individual is going to be framed through that specific culture. So we refer back to our slides, the intent is to provide a perspective, right? We're trying to identify that perspective of that very specific group of people or that culture. But we use culture a whole lot, huh? We throw around that term a whole lot, but sometimes we don't get to define it. So I'm going to define it here. Culture is simply a shared way of life, right? It's a shared way of life. It includes what patterns do we expect? What interactions do we expect? What beliefs do we have? How is it that we adapt to a certain change or our environment? So every time you hear the word culture, I want you to think about how is it that we share our view, right? So your view as an undergraduate student, it's going to be different from the view of a graduate student. That student, their culture is going to be very different. Their perspectives are going to be very different. Say, for example, a Ph.D. Psi-D EDD major. So any questions about that? Of what culture actually is? Notice that we use culture to basically provide a set of rules or understanding of how is it that we're going to behave, right? So for example, in our culture, right, we meet someone, we shake hands, right? It tells me when I meet a new person, I shall shake their hand. Notice that culture allows us to guide our behavior. Not so much after COVID, huh? I used to shake hands for everyone. I'm like, see you later. Stay over there, stay over here. We spend so much hand sanitizer and stuff at work. Like I'll be having play therapy with a young child. They're 4 or 5, and they're like, and I'm like, oh, save me. But that's part of the job, isn't it? That's part of the job. Now, let's talk about participant observation. What do we mean by that? What I'm trying to do, I'm trying to participate, quite literally. I am trying to join in the group that I am observing. I am trying to get in there. I'm trying to roll up my sleeves and get into that environment, right? So you might have seen that. You might have seen that in somewhat of historical research. For example, imagine that I want to study, conduct this type of study with a group of people, a specific group. So for instance, I want to study homeless women in town, right? So for this type of study, one of the best things to do would be for me to become homeless with them and be there in their camp or eat with them, sleep there, spend the night with them, spend the day with them, going through that experience with them. And that does occur. There are many researchers that take that approach because, sure, we can get that narration, but sometimes the researcher wants to get that experience firsthand. I can see it both ways. I can see why that would be beneficial. but it's pretty difficult, right? I would argue, well, okay, sure, it's pretty neat that you're in there, you're getting the information firsthand, but notice that woman's experience who's homeless is different from mine, right? For example, I'm a millennial. I would like to believe I'm middle upper class, right? This woman is homeless. We're not going to view the same experience of trying to ask for money, trying to scrap food, right? Dealing with the dangers of being on the street. I would argue we won't see it the same way, right? But nonetheless, it is a method that it is utilized. Now, in this specific case, it is immensely imperative that you are neutral in these interactions, not only for this type of research, but I would argue that you need to take this work with you into practice. So not only for research, but this is also immensely important in practice. You need to remain neutral because lack of neutrality, what it could result in is now you're hindering the experience. Now you're not getting the experience as you normally would. What is going to happen is perhaps you have become that, I would hate to call it a covariance, right? Because we're talking about qualitative research. And if you recall from quantitative research, a covariant is basically a factor you couldn't control that influences that interaction between independent and dependent variable. You almost become that very same thing when you start losing that neutrality. So, any questions about an ethnography? So I know that a lot of you enjoy seeing examples, right? I know a lot of you enjoy seeing examples of the types of research that we present. So I am going to pull up an example of a field research study, also known as an ethnography.
Video is called field research or ethnographic research. In this kind of study, the researcher, whose name is Maria, hangs out with and gets to know the members of the community she is trying to understand. In the scene you're about to watch, Maria has been spending several months with people in the neighborhood who use heroin and who have or are at risk of getting HIV. She is both talking with drug users about their sexual practices and observing their drug use to understand the conditions that lead them to share needles and drug injection equipment. In these types of studies, the researcher usually gets to know one or two drug users very well, and these drug users introduce the researcher to other drug users in the community. In this video, Maria is meeting with a drug user named Steve. Steve agreed to be in the study 2 months ago. Since then, he has introduced Maria to a lot of people he uses drugs with for the study. As you watch the video, think about what problems the current situation is making for both Steve and Maria, how they are both feeling, and what should be done.
Hey, Maria. What'd you bring me today?
The usual, the sandwich and a coffee.
Oh, great. I'm starved.
Steve, I'm so glad you've introduced me to so many people in the neighborhood. It's really helped me to find people to interview for my research.
Yeah? Well, Chris told me about the interview you did yesterday. And how are you going to do another one tomorrow? You know, I've been going out with Chris for about a month now. What did Chris tell you about me?
You know I can't tell you the things that people tell me, unless they're planning to hurt you. I can't even tell Chris the things you've told me.
Good. Because I wouldn't want Chris to know I'm HIV positive.
You mean Chris doesn't know?
No. Chris is negative and we don't use protection.
I wish you hadn't told me this. Now I have a problem. Remember I told you that if I found out that you might be able to hurt someone, I'd have to tell them?
No, I don't remember that.
Well, when we first met 2 months ago, you signed a consent form. that said that I might have to let someone know if I knew you were planning to hurt them. I thought you understood.
Yeah, well, I was probably high, and I needed the money you're talking about. Anyway, I wouldn't hurt Chris.
Yeah, but you could still infect Chris with HIV. Doesn't Chris have a right to know that?
Anyway, I know people who have sex with people who are positive who never get HIV.
You're still taking a big risk. You should say something to Chris, or I could tell.
No way. I gave you permission to write down stuff I talk about, not to ruin my sex life. If you told Chris, it'd be over, and I couldn't handle that. Can we just finish up the questions you have, talk about Chris later? What other questions you have, Marie, for me?
Okay, let's get the usual questions out the way. When was the last time you got high?
Well, yeah, actually, it's been hours, and I'm really kind of freaking out. I might not even be able to finish this interview. I really need a fix now, and I don't have any money. Hey, I got an idea. You know how you usually pay me after we meet? Well, why don't you give me some of the money in advance, and I can go get a fix now? Yeah, you give me half the money right now, and I can go get my stuff, and I can come back and finish answering your questions, and then get the rest of the money. As long as I get some of the money right now. Come on. We're friends, right?
I don't know.
All right, so thoughts, comments, questions, or concerns? Very interesting video, wasn't it? So any questions about this video? I like asking, what do you think went well? Yes, ma'am. Very.
She set boundaries with the client.
You like that what? I'm sorry?
She set boundaries and she didn't give in to, his kind of request. She stated that she was like uncomfortable.
That she didn't feel comfortable?
Yeah, like she didn't just be like, oh yeah, here's the money to make you feel better.
Okay, so that she didn't have that type of, okay,
Like she didn't.
that boundary. Gotcha, okay. I think she would have done it, she could have done it differently, but I do agree that that was a good step, right? Having that boundary. So what the feedback that I'm getting from Dr. Sarah is the consent, how the responsibility, liability of was this person intoxicated or high while they signed that consent? What is the implication of him being high and reporting, quote, that he was high while he signed that consent, saying that he does not remember, saying that he agreed only to be interviewed, not for, quote, for her to ruin his sex life, end quote. How would you guys have approached that? How would you approach that situation saying, well, I didn't read that, or I don't get that? What do you think would have been an okay approach when it comes to research? A really good technique is to actually go through the informed consent with the participant, with the client, not just simply handing them, right? Hey, read this, sign this. Why is that? Well, because number one, you want to ensure that the person is in fact capable of even understanding the text in the first place. Because if you remember, whenever we are writing something, we want to keep it at least a middle school, high school level, right? We don't want to write anything that is above that level. And this is one of the reasons, maybe because your client may not have the capacity, whether because learning disability or intoxication, and they may not have the capacity. Maybe stress, maybe depression, maybe anxiety. At the time they're reading that consent, they may not have the ability to do so. And another thing is make sure that the client understands the actual language, right? So for example, if you're treating someone or asking a research participant to participate and English is not their first language, and you can tell that there is a significant hindrance to that application, right? For them to read that, then the ethical thing to do would be to provide the informed consent in a language that they can understand. Interestingly, where I started working where I work, all of the papers, informed consent, all of that, where I work, nobody was seeing clients that spoke Spanish because nobody spoke Spanish, and I knew. So when I started working there, one of the very first things that I did was to ask my boss for all the copies of all the forms that we hand over. And I translated them, right, into Spanish. So I sat down and translated them. And every time I have a client, I physically sit down with them and explain their patient rights, what they are agreeing to, so they know what consent is, right? Explaining that they have the right to confidentiality, as he mentioned in the video, he does have a right to confidentiality. However, if the person is reporting that he is a significant threat to another individual or to his person, now we have to start taking other steps, right? So it's really important that if you wanted to minimize that problem, what we can do is go through the process with them. So first, that the person understands the language of the consent. Secondly, that you actually go through it with the client or research participants. And number three, give the person an opportunity to ask questions. Give the person the opportunity to say, okay, we went through the informed consent. What questions do you have? Give them the chance to ask you a question. You don't want to say, okay, we went through it, good, let's get started with our research. You want to give them the opportunity to say, wait, hold on, this here, can you go through that again? Can you explain a little bit what harm means, right? You have to give the person the ability to ask questions, not only for your clients, but also your research participants. All right. Any questions about the video? It's pretty difficult to conduct studies with a specific population. There are many, many things that I would have done differently. One of them being the approach that she had. You always want to see whether or not the person can do things voluntarily instead of you trying to break confidentiality. But in this case, it didn't work because she did bring that up. She said, okay, you can go ahead and tell your partner. And if that doesn't happen, then she may be obligated to do so. There are some issues, right? There are some issues that we can come across whenever we are conducting this type of study. One of the things that we need to consider of that participant observation is that we may find someone who is just ready to go. You have someone who is simply really trying to participate in your study, right? So in the video that I just showed you, it appears that this gentleman would have fallen in this category of the eager speaker. It seemed that he could just not wait to participate, perhaps because of the monetary compensation that he was receiving. And that's another ethical issue. She brought him food, she pays him money, so that's another ethical concern. We may also have the issue that we come across a good citizen, right? You just simply have someone that really, really believes that what they're trying to do is help the researcher, that they're contributing to the greater good. And sure, we may be in that particular situation, but notice that can bring me some bias, right? Because if I'm trying to be the good, outstanding citizen that is trying to participate in your ethnography, then am I really giving you the whole picture, right? Am I really telling you the nitty-gritty of what's going on? You also may come across, if we revert back to our slides, you notice that we may have some stereotypical aspect. You may, for example, have a stereotype yourself, right? So when you were watching this video, did you already come across the stereotype of, say, for example, what an HIV positive person looks like, what a person that has a romantic interest with another gentleman looks like, right? So that bias can come from you as well. Now, something important is when we are thinking about gaining access to a group, we want to do so in an unintrusive manner. We don't want to plug ourselves in this group that's already an identified community. So for example, in this particular video that we just saw, we had a group of people who are experiencing a certain concern with their public health and addiction. And now me, the little researcher, this is me, by the way. Look at that long hair. Perfect. Looks just like me. And now I'm trying to plug myself into this particular research. That could be viewed as I'm trying to be intrusive. But there are many things that you could do in order to avoid this specific problem. So let's think about, we could gain access to this group without having to cause any change in their behavior by entering this group covertly, right? I'm trying to basically become my own confederate, right? I'm trying to become the person that is inside the group without looking any different. I am still just like them, right? I still become, if this is what I look like normally, whenever I enter this specific group, I'm trying to blend in, if you will. I like to think about, for example, police investigations when they have an undercover person. That will be basically the equivalent that I am referring to. Now, another way is to do the complete opposite. It's to actually announce yourself, right? And request entry. Make sure that this process is not meant with resistance, right? That this process is not meant with resistance. So I'll give you an example of something similar, right? So I used to work, I technically still do, but I'm as needed now. I'm in a PRN as needed basis. But when I was working there all the time, something that I would like to do is that, first of all, I'm an outsider, right? I am not an inmate, right? And that in and by itself can cause some conflict whenever I'm trying to introduce myself into this population, because ultimately this is their house, this is their life. And here I come with my little doctorate, like, hey guys, how you guys doing, right? So you're plugging yourself into this population. Number two, I'm not an inmate, right? There, I am a female, and this is a male prison. So there are so many differences. The racial makeup is immensely different of mine. So now I'm coming in with my own race that is generally different from the racial makeup that is present here. And my problems are very different from their problems. So notice that all of these little differences are going to cause some friction, but it is my job that in order to be able to assist these individuals, that I request access, right? So generally, if I had to go in where they live or go to their dorm where they sleep, I ask. I just don't walk in here. It's like, oh, here's his bed, here's this other bed, and this is where he sleeps. I ask. I show them that I'm trying to be mindful and respectful of their experience in their environment. And usually, you're going to have a more acceptance, if you will, when you're trying to help an individual or when you're trying to gather research. Because remember, when you're doing an ethnography, you're the outsider, right? These people don't owe you anything, right? They don't need to accept what you're trying to, quote, sell them, right? What you're trying to, quote, preach to them, right? Or what you're trying to use them for, right? And you'll hear that a lot with research. You're just trying to use before you're studying, right? So notice that you want to introduce yourself, request that entry, and you can also do it covertly. So any questions about that? Good deal. Now, we have talked before about case studies. And generally, when we are referring to a case study, we are referring to an immensely unique experience, right? We're dealing with something that most people do not experience, right? And you're saying, well, hold on. You just told me that one of the things that it's immensely irrelevant is to find out how much can we apply the information that we have in this research. And I'm trying to move it from my research observations into the application of another group, right? Another population, right? You just said that. Sometimes there is value in studying something that is very unique, that perhaps is not as, that we don't have to generalize, right? In terms of quantitative research and qualitative research, that we don't have to apply to another population. And why is that? A case study provides the researcher the opportunity to study unique factors, things that we're generally not exposed to, that can help me as a researcher or myself as a practitioner to understand abnormalities, I should say, to understand, say, for example, what normal, average, typical behavior or expectations are, say, for instance, maladaptive behavior. So notice that, yes, even though we are concerned with generalizing our results or applying our results, we're also interested in a very unique case. Generally, a case study can be as small as just one person. It could be simply just one person, or it could be a very unique, very unique group of people, right? Event. It can be something very unique. So for example, generally when we have case studies, we think about a very small, very small group, and sometimes just one person. But imagine that for some reason, we discover, say, a new group of indigenous people, right? A new group of native people in a country. That would be a case study, even though it's a whole little village, right? It's a whole group of people. But notice that that could be considered a case study because it is so unique. We've never come across this before. This is a brand new group of people, brand new culture, right? And like our friend, Dr. Harper was mentioning, now we have a whole new culture, a whole new group that we are trying to investigate. Now, why is it important? Well, because I am trying to illustrate, right? I am trying to observe a very interesting, unique phenomenon. Because it is so unique, it allows me to explore new hypotheses that I simply did not have before. So if you do your literature review, right? If you are, for example, what things that we do in lab, that you're looking into, okay, I'm looking for CFA analysis, right? You're looking for specific research questions. Whenever we have this presentation, it will be immensely unlikely that you're going to find those research questions because simply we were not expecting this specific case. So it allows for a brand new, a plethora of new hypotheses that we can actually develop. We also like to do a comparison, right? We like to do a comparison with perhaps other aspects. So for instance, I want to compare, say, for example, if I had a feral child and I'm trying to compare it to, say, another feral child. For those of you, there's some more unique cases. So we could start drawing comparisons between one person and the other. And we can also look at case history. And what do I refer about? What am I trying to say about case history? When I'm doing a case history is basically a description, right? It's a description of the history, the background of that individual, that small group that's being observed. I'm trying to provide a very in-depth understanding of the history of that group. So for example, if we were to find a new group of indigenous people, we would try to understand a case history. We would try to develop, okay, what's the history of this group? So any questions about that? Any questions? I do want to give you an example that perhaps is not necessarily case history or a case study, but it is the first time that I've ever encountered this. And this just happened, I think, Monday or Tuesday. So it's really fresh for me. So I had received or was attempting to receive a referral for this group of people, right? And so they came from really far just for this appointment. So it was immensely interesting for me because it's simply something that I was never exposed to before in supervised practice. So these individuals came from a very rural, very isolated, very underprivileged indigenous community. And I've never worked with that type of population before. I've never worked with someone who doesn't have a concept of what electricity is. They didn't have a concept of what like washing your hands. And why is it that I have to wash my hands? Well, because there's bacteria. So, well, what's bacteria, right? So I've never had to deal with a situation. They didn't speak. I guess the issue was that they thought that they spoke Spanish. Stepdad speaks some Spanish, but wife and children speak a Native American language. So it was very an indigenous language, right? So it was immensely difficult to work with this population. So notice, had we had more access to this type of study, I could at least inform my practice, right? Unfortunately, treating this individual will be outside of my scope simply because I'm not familiar with the culture. I'm not familiar with Native Indigenous people, Native American people from Latin America or Central South America, right? So just like we do in America, they have Indigenous peoples in other countries. So to me, had this been conducted, right, and I've been able to find research like this, I could educate myself to better serve this group of people. It was an immensely interesting experience. I actually felt conflicted because I'm thinking, wow, I'm it, huh? I'm the person that has to help them. And I'm having a hard time because I don't have this type of information, right? So it happened, I think, Tuesday. So 2 days ago, for those of you who are watching the recording, about 2 days ago. So it was very interesting. So now you know this has real life consequences, right? Being able to study a group that is so small. But yeah, I had to Google it. I had to Google it. I had to do some research. Wow, I have no idea what's going on. All right, let's talk about different types of case studies. Let's think about when we're thinking about an illustration, an exploration, or the collection of data when it comes to these case studies. When we are trying to do an illustration, right? When we're trying to do an illustrative case study, what I am trying to do is investigate rare aspects, right? I'm trying to explore rare aspects that are simply very unknown, right? I'm trying to provide you an illustration. And something really good to do, we can do a little visual imaging. When we think about an illustration, right? Think about an police sketch artist, right? This suspect is unknown. This is rare. I have no idea who this person is, so I'm going to draw an illustration, right? Very similar to that analogy is that of a case study who provides an illustration of a rare unknown case. Now, when we're trying to do an exploratory case study, it's basically a preliminary analysis, right? This is simply a preliminary analysis. So now that I know what it looks like, right? I know what it looks like. Let me see if this is worth some of the effort. Who is this going to help? How is it going to serve, right? This provides me the opportunity, this pre-analysis allows me the opportunity to start developing some of my hypotheses, right? So start developing my hypotheses. Is it indeed a procedure? Is this an endeavor that I'm trying to go through? So now that I know what it looks like, now let's start exploring. Once I have determined, right, these new potentially important hypotheses, now let's move into the collection, right? Let's move into the collection. I'm trying to, once I did that data, I'm trying to compare, right? That individual analysis. So I'm trying to draw that comparison, right, to other analysis and other cases that may be related, right, to other cases that could be related. So notice that we went from not knowing anything whatsoever to identifying the hypotheses, and now we are using the information that we gathered to compare groups of related information. I would argue that every single type of qualitative study is going to precede quantitative. If I don't know what it looks like, how am I supposed to do a statistical analysis, right? I argue that every single qualitative research you've ever seen should have occurred before a quantitative research, right? Now, there are several applications, right? There are several applications for case studies. And as you can see, we can have a general inquiry. Basically, I'm trying to, okay, let's find out these unknowns, right? I have a hypothesis that I have developed about this phenomenon. So let's answer that unknown. Now, another purpose of a case study, right? Say, for example, we can try to develop perhaps a brand new theory. And remember, theory, every time you see the word theory, I want you to think about the word explanation, right? Every time, because that's what a theory is intended to do. It's a set of hypotheses, facts, and evidence that tries to explain a observation, right? So every time you see the word theory, always remember it means explanation. People hear theory, especially laypersons, and they think that theory means guesswork. Oh, I have a theory how to play the stock market, right? Well, that's not what theory means, right? It's not a guess, it's not an educated guess, it's an explanation. Because of that, because I'm trying to provide an explanation, case studies allow us to identify information that could either help us provide more development for a theory or other aspects of theory development. Now, remember, case studies are qualitative. They are qualitative in nature. Notice that in the things that we mentioned here about case studies, none of them, right? None of them refer to numbers, right? None of them refer to a specific type of, we're going to do an ANOVA, we're going to do certain type of statistical analyses, we're going to do a correlation, because that's not what we're here for. I'm here to learn about the phenomena. I'm not here to draw statistical conclusions about the phenomena. However, I say that to say that we can have some quantitative data present, right? So it's not strictly a numerical quantitative approach, but notice that there could be some quantitative data. And if you recall from our previous lecture, you'll remember that one of the things that we talked about is whenever we have a quantitative research, we may start drawing some frequencies, for example, the time frame that you conducted your observation, how many times that you observe a pattern. So remember, in naturalistic observation, we talked about how many flirting behaviors do I see at a club from 10 p.m. to 2 a.m. That is a number, that is still a quantifying feature in a qualitative research, such as a naturalistic observation. Now, when we are talking, and the last thing we're going to talk about is some ethical considerations, right? Notice that one of the things that I brought up was you have the ability to conceal yourself and introduce yourself, right? So you have the ability to introduce yourself into that specific group, right? You have the ability to conceal yourself into this group, right? You have the ability to do so. What are the ethical considerations of doing so? Well, notice that sometimes we have to conceal our identities. Now, these are some ethical arguments, right? These are some ethical arguments for and against concealment. Now, when we're thinking about the Belmont principle, what we're trying to consider is, do I have respect for the persons, right? I like to think about, especially for younger researchers, it's like, oh man, that would be so cool to go and study some inmates, right? That would be so cool. Are you actually respecting these individuals that have, they have value, they have worth, they have an identity, they have their own struggles? So why exactly are we doing this research, right? So do we have respect for the person's privacy, right? Do we have respect for the person being a research participant, I should say? Have any respect whatsoever. Another important factor is to protect the identity of the participants from other people. If you remember from the video, the individual playing the role of Maria, in that specific case, she was trying to provide confidentiality in terms of what Steve said and what his partner said. Any questions about that? Good deal. It is a tricky one because you can argue, well, there's a lot of benefits. There was a lot of positive things that can come from this type of study. And if there are no questions, I will see you guys for the next lecture. Thank you.